I'm joined by Dr. Narendra Gupta, who's a public health expert. Dr. Gupta, thank you so much for making time and speaking to Mirror Now. I think everyone in this world is waiting for that day to come when they can take off their mask and finally live a life that does not talk about COVID. There are no COVID restrictions. At the moment, Maharashtra government is consulting experts on whether the state should go mask-free or not. What is your view on this development? Do you think it's a prudent move, or do you think we should wait and observe what is happening around the world and then go ahead with it?
Yeah, world over, gradually, most of the countries where this pandemic hit the most are now getting into the phase of mask free. But in a country like ours, in India, where communicable diseases are quite rampant, it will be much better not to go mask free immediately, but do it gradually. Gradually in the sense that it could be started form of where people are not crowding too much, like in parks or on open roads or all these kind of places where there is a lesser possibility of getting infected. So people could move without mask there. But if they are at crowded place, at lots of people gathering together, I think mask is should continue for some more time till we become very sure that that pandemic has almost gone and the disease is just like an endemic, any other kind of a respiratory disease. So that would be a much better. And in a state like Maharashtra, the big cities where large number of people live, much better approach would be to continue with the mask and gradually start removing it rather than continuing do it at nauseum just in one go.
All right, Dr. Gupta, we have certain precedents also. Say, for example, Israel tried to do away with the masks, but they had to bring it back because the cases increased in the country. Do you think we need to take a leaf out of that chapter and maybe, like you said, that take a look at the global pattern and observe a wait and watch policy?
Yeah, wait and watch would be a good thing, and then keep collecting the data about the rate of infection which is taking place, and then whatever policy is adopted, it should be context specific, area specific, in terms, as I said earlier, that if people where lots of people are getting together, it will be much better to keep the mask on, so that not only you prevent yourself from this particular disease, but you also prevent yourself from other kind of communicable diseases which are possible. So there's no harm in maintaining a mask approach. And but in areas which are open, where fresh air blows regularly and there's not too much of crowding, it is always good to go people mask free. So it has to be calibrated and nuanced in terms of the areas and in terms of the kind of people. If you find somewhere people who are positive, then you have to maintain a mask approach there. If you find areas which do not have not reported people with infection, then you can gradually remove masks from there. So there should not be one blanket approach. That is very important and essential in this.
Right. Thank you so much, Dr. Narendra Gupta, for helping us understand your perspective on this story. So the process of consultation is on. Maharashtra government is consulting experts on whether the state can go mask-free given a dip in the COVID trajectory in the state.